Welcome to the Al-Ghaf Dynamics HealthConnect Middle East podcast, your weekly roundup of healthcare, wellness, and life sciences developments across the region. This week's edition covers the key stories from October 2nd through October 9th, 2025. It was a week marked by bold government initiatives, groundbreaking medical innovations, and persistent public health challenges. Regional authorities pushed forward with ambitious healthcare reforms and collaborations, from new bilateral agreements and policy reforms to high-profile global summits, signaling an ongoing commitment to strengthen health systems. At the same time, Middle Eastern scientists achieved notable research milestones, including a pioneering AI-driven cancer vaccine, underscoring the region's growing contributions to global medical innovation. Yet these advances unfolded against a backdrop of formidable challenges. Conflict and humanitarian crises continued to ravage health services in areas like Gaza, Syria, and Yemen, while economic strains and staff shortages tested healthcare resilience in countries such as Lebanon, Iran, and Morocco. In this report we'll walk through key sections, from policy and research to hospitals and population health, bringing you detailed, country-specific updates and analysis. Our sources include official health ministry releases, news agencies, WHO, UN updates, and NGO reports, all carefully cited below. Our information is drawn from regional health ministries, pharma and biotech institutions, advanced data and news outlets through our internal data and analytics platform, HealthConnect Middle East. First, we have healthcare policy and government initiatives. Governments across the Middle East took significant policy steps and forged partnerships to bolster their health sectors this week. In the Gulf, a notable bilateral agreement saw Kuwait and Bahrain sign a memorandum of understanding on October 4 to enhance healthcare development, medical training, and expertise exchange. Officials highlighted that this Kuwait-Bahrain health partnership will improve access to treatment through faster services and upgraded hospital infrastructure, and strengthen emergency preparedness for both nations. By focusing on joint capacity building, from training doctors and nurses to sharing best practices in chronic disease management, the two countries underscored how Gulf cooperation can raise healthcare quality and affordability for their citizens. This agreement aligns with a broader regional trend of leveraging international cooperation to address healthcare gaps. For example, health ministers from Yemen and Jordan met in Oman recently, as in August, to expand a program for Yemeni doctors to train in Jordan, illustrating how cross-border initiatives are being used to shore up human resources in conflict-affected states. The new Kuwait-Bahrain MAU builds on that spirit by uniting two stable Gulf systems to share knowledge and jointly confront common health challenges. Qatar, meanwhile, took center stage in global health diplomacy by hosting the 6th Global Ministerial Mental Health Summit in Doha on September 30 to October 1. The high-profile summit convened ministers and experts from dozens of countries under the theme, Transforming Mental Health Through Investment, Innovation, and Digital Solutions. As the conference concluded on October 1, delegates adopted key priorities to translate international commitments into national action plans for mental health care. Qatar's Minister of Public Health, Dr. Mansour Al-Mahmoud, emphasized the shared regional and global commitment to improving mental health at national, regional and global levels, noting that the summit's outcomes will spur greater investment in mental health services, digital platforms, and innovative care models across participating countries. By championing issues like expanded funding, equity of access, and technology-enabled care, the Doha summit positioned mental health as a policy priority not just for Qatar but for the wider Middle East. Indeed, representatives from many Arab states, including Saudi Arabia, Egypt, and Bahrain, were present, reflecting a growing regional consensus that mental well-being is integral to public health. The adopted priorities call for more integrated mental health into primary care, use of digital tools to reach underserved communities, and cross-country knowledge sharing. This marks a significant policy push to elevate mental health on par with physical health in government agendas. Another example of regional health policy collaboration unfolded in Oman, Jordan, where the country hosted the 8th Islamic Conference of Health Ministers, OIC Health Ministers meeting, on October 7 to 9. Delegations from over 50 Muslim-majority nations, spanning the Middle East, Africa, and Asia, gathered under the banner, "Health is our shared responsibility," to coordinate strategies on issues like pandemic preparedness, immunization, and health system strengthening. At the conference's conclusion, ministers issued the Oman Declaration, reaffirming their commitment to bolstering health cooperation across the Islamic world. The United Arab Emirates Minister of Health, for instance, stressed the UAE's dedication to joint initiatives for universal health coverage and health security, offering to share the Emirates' experience with digital health and AI innovations with other member states. Saudi Arabia's delegation likewise highlighted the kingdom's support for integrating e-health and emergency preparedness systems among OIC countries. Such high-level engagements signal a policy shift toward collective action, recognizing that many health challenges, from polio eradication to disaster response, transcend borders and require unified solutions. The OIC Forum also saw the launch of an OIC Health Report 2025 by CESRIC, providing data to guide evidence-based policies. Overall, the conference underlined how Middle Eastern governments are increasingly leveraging multilateral platforms to advance health development goals and speak with one voice on the global stage. Individual countries also pursued important domestic health policy initiatives during the week. Oman held a national consultative session on October 1 to update its national policy for prevention and control of non-communicable diseases, NCDs. Chaired by Omani experts and multi-sector stakeholders, the session aimed to ensure the policy is comprehensive and integrated across different sectors, identify gaps and new priorities, and refine governance and monitoring mechanisms. Her Highness Dr. Mona bint Fadl said, who leads Oman's National NCD Committee, lauded the progress Oman has made in combating lifestyle diseases but stressed the need for sustained teamwork to achieve the policy's goals. By bringing together health officials, academics, and even non-health sectors, Oman is reinforcing an evidence-based, health in all policies approach to tackle diabetes, heart disease, cancer, and other NCDs. This inclusive policymaking mirrors efforts elsewhere in the Gulf. Saudi Arabia, for example, earned praise from the UN this week for its whole-of-government approach to NCD prevention. Egypt's leadership also reiterated its commitment to health sector reform as a top national priority. On October 2, Prime Minister Mustafa Madbuli affirmed that healthcare, education, and the Decent Life, Rural Development Initiative remain at the forefront of the government's agenda. In a cabinet meeting, Madbuli emphasized that after years of heavy investment in infrastructure, the focus is now on improving the quality of health and education services for citizens. This came on the heels of Egypt's Ministry of Health strengthening interministerial cooperation. Late September saw Health Minister Dr. Khalid Al-Ghaf meet with other ministers to expedite hospital projects, streamline administrative processes, and integrate military production expertise into building new healthcare facilities. Indeed, several new hospitals, medical warehouses, and family development centers are under construction in Egypt's new administrative capital and other regions, slated for completion in 2025. By coordinating with the Ministry of Military Production and Administrative Reform agencies, Egypt aims to overcome bureaucratic delays and ensure its ambitious health infrastructure projects are delivered on time. This whole government mobilization illustrates Egypt's drive to modernize its healthcare system and expand capacity, goals that align with President El-Sisi's Vision 2030 and have been accelerated in response to public demands for better services. Across the region, the past week's policy and government initiatives shared a common aim: to build more resilient, responsive health systems despite varied local pressures. From Gulf states leveraging diplomacy and data-driven planning, to conflict-hit countries launching creative stopgap programs, to North African states scrambling to fix workforce and infrastructure gaps, each country is grappling with how to translate high-level strategies into better health outcomes on the ground. The tone is increasingly proactive and collaborative. Health leaders are not just reacting to crises, they are also planning for the future, whether through international summits, new laws and policies, or public commitments to accountability. While challenges like funding constraints, political instability, and population growth test these efforts, the trajectory is clear: effective health governance is now recognized as integral to social stability and development across the Middle East. Life sciences and research innovation is next. The Middle East's life sciences sector demonstrated inspiring progress during the week, with regional researchers and institutions pushing the boundaries of medical innovation. A groundbreaking achievement came out of Iran, where scientists announced the development of the world's first AI-designed, personalized mRNA cancer vaccine. A team at Tehran University of Medical Sciences unveiled a smart mRNA vaccine for lung cancer that uses artificial intelligence algorithms to tailor the vaccine to an individual patient's tumor genetics. This personalized approach can drastically cut development time, the Iranian researchers report, designing and producing each patient-specific vaccine in just 2 to 3 weeks, roughly a 90% reduction compared to traditional methods that take years. Built on the same mRNA technology underpinning COVID-19 vaccines, the experimental cancer vaccine employs AI to predict optimal antigen targets and formulate the vaccine without the usual trial-and-error lab work. Dr. Mohammad Hossein Yazdi, who leads the project, explained that unlike conventional vaccine R&D, which requires lengthy iterative testing, their AI-driven system identifies the best candidate before entering clinical phases by relying on genetic data and AI predictions. This means potential cancer vaccines could be readied for clinical trials much faster and with greater precision. While the Iranian smart vaccine remains in the research phase, clinical trials are expected to take 2 to 3 years. It represents a major biotechnology milestone for the region. It shows how Middle Eastern scientists are leveraging cutting-edge fields like genomics and machine learning to develop personalized medicine solutions for diseases that were once considered untreatable. If successful, such innovations could revolutionize cancer therapy, turning it into a tailored, on-demand service, and also place Iran among the pioneers in the burgeoning field of AI in drug development. Elsewhere, Saudi Arabia continued to bolster its reputation as a regional hub for medical research and health innovation. Although much of Saudi's big news in early October revolved around upcoming partnerships, see biotech section, and accolades, see wellness section, the kingdom's past investments in research bore fruit recently. For instance, a study by King Faisal Specialist Hospital and Research Center on robotic liver transplantation was recognized as one of the 10 most influential research papers of 2024 by the American Society of Transplantation. While this recognition came in late summer, it underlines Saudi Arabia's growing contribution to high-end clinical research, particularly in areas like organ transplant techniques, genomics, and regenerative medicine. Saudi research centers are increasingly producing work that gains international notice, aligning with the country's Vision 2030 goals to become a knowledge economy. Additionally, the Saudi Ministry of Health highlighted that 16 Saudi cities have now earned WHO Healthy City designations, including Jeddah and Medina, the first Middle Eastern cities over 2 million people to be accredited. This achievement, while rooted in public health, was backed by rigorous data collection and multidisciplinary research into urban health metrics, spanning pollution, infrastructure, community programs, etc., indicating a synergy between research and policy. Qatar also reinforced its role as a research and innovation leader in the region. Fresh off hosting the Mental Health Summit, Qatar is building on its strong biomedical research infrastructure, such as Sidra Medicine and Qatar Genome Program. While no specific new study was reported this week, it's worth noting that Qatar recently launched an ambitious newborn genomic screening initiative, Begin NGS, in partnership with a U.S. institute, aiming to sequence infants for hundreds of treatable genetic disorders. That program, which was announced in late August, is presumably moving into implementation this fall. It exemplifies how Gulf countries are translating research into precision medicine services. By sequencing the DNA of newborns, Qatari researchers and clinicians hope to detect conditions early and develop personalized care plans, putting Qatar at the cutting edge of preventive genomics. Meanwhile, Qatar's scientific community was gearing up for the country's first disease modeling and therapeutics conference, which took place at the end of August, a gathering that likely spurred new collaborations and follow-on studies in drug discovery and computer-aided biology. The momentum from such events tends to carry forward. We can expect to hear about new research partnerships or grant programs in Qatar in coming weeks, as outcomes of those conferences materialize. In North Africa, Egypt pursued its strategic vision of becoming a regional pharmaceutical research and production hub. Although the headline moves, like forming a high-level committee to boost pharma R&D and exports, occurred in earlier weeks, the effects are ongoing. Meanwhile, Iraq undertook an interesting fusion of research and healthcare planning. On one hand, Iraqi health authorities are partnering with international organizations to improve data systems. For instance, completing a national student health survey in late summer to gather evidence on adolescent health behaviors. On the other hand, Iraq is launching large-scale projects, discussed in hospitals section, that have research components, such as an integrated medical city which could become a hub for clinical trials and medical education. Additionally, this week an Iraqi delegation was likely present at the OIC Health Ministers Conference where CESRIC launched the OIC Health Report 2025, providing comparative research on health indicators across Muslim countries. Being armed with such research allows countries like Iraq to benchmark their progress and prioritize investments, for example, in maternal mortality reduction or vaccination coverage, relative to regional peers. Collaborative research efforts also made news. The WHO's Eastern Mediterranean Regional Office held a simulation exercise in late September on cross-border disease surveillance, involving Egypt, Libya, Sudan, Tunisia, which recommended establishing digital platforms for real-time health data sharing. This kind of initiative blurs the line between research and practice. It involves studying existing gaps and simulating scenarios, research, then proposing technological solutions, innovation, to improve early warning of outbreaks among migrant and mobile populations. Such recommendations, although just proposals now, may lead to the development of new data systems or pilot studies in the coming months. In summary, the life sciences and research innovation landscape in the Middle East during this period was vibrant and future-focused. High-impact scientific breakthroughs like Iran's AI-personalized vaccine stood alongside strategic research programs aimed at public health priorities, e.g. Egypt's enormous screening data, Qatar's genomic medicine, Saudi's transplant research and healthy cities analytics. A collaborative ethos was evident. Researchers are partnering with international bodies, as seen with Oman and the UN on NCDs, and sharing knowledge at summits from Doha to Amman. Importantly, many countries are aligning their research agendas with pressing health needs, combating cancers, reducing NCDs, improving maternal, child health, and harnessing digital technology for health solutions. As these research initiatives bear fruit, they promise not only to improve healthcare within the region but also to contribute novel solutions to global medicine, whether it's a new vaccine platform from Iran, a vast dataset on women's health outcomes from Egypt, or a model of digital epidemic surveillance connecting multiple nations. The Middle East's scientific ambition, coupled with its willingness to innovate, signals that the region is steadily transforming from a consumer of medical knowledge to a producer of cutting-edge health research on the world stage. Next are biotech and pharmaceutical developments. The biotech and pharmaceutical sector in the Middle East saw robust activity, as countries balanced efforts to achieve self-sufficiency in health supplies with moves to integrate into the global pharma market. A major highlight came from Saudi Arabia, where plans were laid for a new wave of biotech and pharma investments to be unveiled at the end of October. The Saudi Ministry of Health announced that at the upcoming Global Health Exhibition 2025 in Riyadh, October 27 to 30, the kingdom will roll out several strategic partnerships in biotechnology, vaccine production, and pharmaceutical manufacturing. Backed by Vision 2030, these initiatives aim to attract foreign investment and accelerate Saudi Arabia's emergence as a regional hub for healthcare innovation. The scale of Saudi ambition is evident. The country's healthcare industry is projected to grow from SAR 199 billion in 2020 to SAR 318 billion by 2030, with the private sector's contribution doubling to SAR 145 billion. To enable this, the ministry is creating a more competitive investment environment, streamlining regulations, and actively supporting innovation across fields including biotech, pharmaceuticals, digital health, and even health tourism. This follows a highly successful exhibition last year that generated over SAR 50 billion in health investment deals. Notable 2024 deals included a SAR 4 billion agreement with pharma giants, NUPCO with Novo Nordisk and Sanofi, to manufacture drugs in Saudi, a SAR 5 billion expansion by a major hospital group, Faki Care, and SAR 4+ billion in acquisitions by Dalla Healthcare. Building on that momentum, the 2025 Expo is expected to yield new agreements in advanced therapeutics, medical technology, artificial intelligence, and digital health solutions, all in line with Saudi's drive for self-reliance and an innovation-led ecosystem. In short, Saudi Arabia is leveraging its market size and capital to become not just a consumer of imported medicines, but a producer and exporter of medical products and technologies. The forthcoming partnerships will likely involve multinational pharma companies setting up local production or R&D centers, as well as supporting local biotech startups, thereby transferring know-how and creating jobs. Egypt, with its large population and industrial base, continued to advance its own pharmaceutical development strategy. The Egyptian government's push to transform the country into a regional medicine manufacturing hub, highlighted by the Prime Minister and Health Minister in recent months, remained a key narrative. During the review week, Egypt's presidential 100 million health initiatives made headlines with milestones, for instance, the women's health screening program, mentioned earlier, and sustained output from the hepatitis C elimination program, etc. Each of these public health efforts has a pharmaceutical component, e.g. procurement of drugs, development of testing kits, etc., and Egypt has increasingly sought to localize production of these inputs. Earlier in 2025, the Health Ministry convened committees to streamline regulations and incentivize pharma R&D, aiming to boost exports of generics and vaccines. While there was no brand new pharma deal this week, it's notable that the Egyptian PM prioritized health and the Decent Life initiative in his October 2nd remarks, which implicitly supports domestic pharma since these programs rely on affordable medications reaching rural clinics. In fact, Egypt has already had successes, such as producing its own biosimilar insulin and hepatitis C treatments in recent years, reducing costs and expanding access. The Egyptian Drug Authority has also been active, approving new locally made drugs and signing MOUs with countries like Sudan and Iraq to supply medicines, thereby expanding Egypt's pharma export footprint. With the current trajectory, we can expect announcements in the near future of new Egyptian vaccine plants, possibly in partnership with WHO or Chinese firms, or expansion of existing pharma industrial zones, like the GYPTO Pharma City, to meet both domestic needs and export goals. In the Gulf region, investments in biotech and medtech maintained a rapid pace. Abu Dhabi is one example. It has in recent months launched major initiatives like the Abu Dhabi Life Science Hub and the Vaccine Holding Center. Across the Middle East, a clear thrust toward localizing pharmaceutical production is evident. Countries are investing in manufacturing capacity, easing regulatory hurdles, and fostering public-private partnerships to both ensure medicine security and create high-value jobs. Saudi Arabia and Oman, though not in the headlines this week, have ongoing programs to attract vaccine manufacturing and build generic drug plants as part of broader economic diversification plans. Jordan and Bahrain are encouraging their private sectors to venture into areas like medical device innovation, contract manufacturing, and clinical research outsourcing, often with government incentives. For example, Jordan's Hikma Pharmaceuticals continues to expand generic drug exports, and Bahrain's collaboration with international hospitals, like King's College Hospital, brings in pharma research trials to the kingdom. During the week, Bahrain's leadership also agreed with Kuwait to focus on medical training and expertise exchange, as mentioned earlier, which will indirectly support their pharma sectors by developing specialized skills, pharmacology, biochemistry, etc., among health workers. Another notable development was the digital health meets pharma angle. Saudi Arabia's Seha Virtual Hospital, recognized as the world's largest virtual hospital, not only provides remote clinical care but also potentially streamlines pharmaceutical services, telepharmacy, centralized prescription management. It was highlighted by the WHO this week for transforming healthcare accessibility through digital innovation. And just a few days ago, Saudi Arabia launched a digital health link with Syria, see Digital Health section, which, among other things, could facilitate teleradiology or telepathology consults, essentially bringing specialist expertise, and by extension, advanced therapeutics recommendations, to Syrian doctors. These kinds of links might allow, for instance, a complex chemotherapy regimen or biologic drug therapy to be supervised by experts remotely, effectively extending the reach of cutting-edge pharmaceuticals into underserved areas without the need for local presence of a specialist. It's a subtle but important trend. Digital platforms are enabling better utilization of high-tech medicines across borders. All told, this week's biotech and pharma news reflects a region in transition, from being primarily importers of medicines to becoming active innovators and producers. There is a palpable energy from Cairo to Riyadh to Tehran focused on building vaccine factories, striking deals with pharma multinationals, nurturing biotech startups, and investing in R&D capacity. If sustained, these efforts will improve medicine security at home, crucial during global supply chain crises, as learned during COVID-19, and could make the Middle East an emerging exporter of health solutions rather than just an end market. The Middle East's pharmaceutical future looks to be one of greater self-reliance, strategic partnerships, and innovation, ultimately aiming to ensure that populations have access to affordable, effective medications when and where they need them. Let's turn now to public health challenges and disease outbreaks. This week underscored the Middle East's ongoing public health challenges, many of which are exacerbated by conflict, displacement, and economic instability. In the Gaza Strip, a grave humanitarian health crisis only deepened as the war between Israel and Hamas ground on into its second year. Ceasefire talks were reportedly underway around the war's 2-year anniversary on October 7, 2025, but the toll on Gaza's health system has been catastrophic. According to the World Health Organization, only 14 out of Gaza's 36 hospitals are still able to deliver even some essential health services as of early October. Relentless Israeli airstrikes, combined with severe shortages of supplies, fuel, and electricity, have decimated infrastructure. 94% of hospitals in Gaza have been damaged or destroyed, per WHO estimates. The human cost is immense. Nearly 42,000 Gazans have suffered life-altering injuries, such as limb amputations, spinal cord injuries, brain trauma, due to the conflict, and 1,722 health workers, doctors, nurses, paramedics, have been killed in the line of duty over 2 years of war. Health facilities themselves have been frequent targets or collateral damage. The UN reported that from mid-September to late September, at least 17 brutal attacks struck healthcare sites in Gaza City. One egregious incident, on August 25, saw an Israeli strike hit Nasser Hospital in Khan Yunis and then a follow-up blast injuring medics and journalists who rushed to the scene, events that drew international condemnation. This week, Gaza's medics continued to operate in nightmare conditions, overflowing neonatal units with no electricity for incubators, makeshift surgeries in basements, and families unable to find basic medicines. The war has also spawned outbreaks of disease amid crowded shelters and poor sanitation. Gaza's population faces what the Red Cross called a desperate humanitarian crisis, with more than 61,000 people killed and at least 151,000 injured since the conflict's start in 2023. A famine was officially declared by a UN Famine Review Committee in August, warning that preventable deaths would surge if food, water, and healthcare weren't immediately restored. In our week, Jordan's King Abdullah and other leaders pleaded for ramped-up humanitarian aid to Gaza. The Gaza situation painfully illustrates how war can reverse decades of health progress in an instant. Child mortality in Gaza and West Bank, which had declined for years, skyrocketed in 2023 to levels not seen in decades. Even if a truce is achieved, rebuilding Gaza's health system will take years of concerted effort, and the mental health toll on the populace, especially children who've known nothing but blockade and bombardment, is incalculable. In Syria, the public health outlook remains precarious, though the intensity of conflict is lower than in Gaza. Syria is still recovering from a decade of civil war that destroyed roughly half of its health infrastructure. The World Health Organization marked World Humanitarian Day, August 19, by confirming 31 attacks on healthcare in Syria in 2025 up to that date, with 5 health workers killed. This week, no new large-scale attacks were reported, but chronic challenges persist. 16.7 million Syrians need health assistance and 7.4 million are internally displaced, living in conditions ripe for disease spread. Northern Syria saw sporadic violence. For instance, on October 5, security incidents in Idlib and Aleppo were noted, which can disrupt vaccination campaigns and delivery of aid. Crucially, Syria and international agencies remained vigilant about cholera, a disease that resurged in the region in 2022 to 2023. As of June 2025, Yemen, another conflict-torn state, had recorded a sharp cholera uptick, nearly 18,700 new cases and dozens of deaths in just 1 month, an 87% jump from earlier months. This trend carried into the late summer, and new data now shows Yemen's cholera outbreak accelerating. Between January 1 and August 31, Yemen logged 72,260 cholera and acute watery diarrhea cases, including 201 deaths, with over 10,800 of those cases in August alone. By comparison, only two other countries, Afghanistan with -116,000 cases and South Sudan with -74,000, have a higher cholera burden this year. Beyond conflict-driven crises, other public health concerns also demanded attention across the region. In the Gulf countries, the issue of extreme heat and its health risks persisted into early fall, though temperatures are gradually easing. The UAE, which over the summer had run a major heat safety campaign for outdoor workers, reported that its multi-phase awareness drive succeeded in reaching thousands of laborers with education on heat stroke prevention and providing cooling stations. By October, these programs were wrapping up as weather improves, but authorities are analyzing their impact, such as reduced cases of heat exhaustion compared to previous years, to plan for next summer. Non-communicable diseases, NCDs, remain a silent public health challenge across the Middle East. High rates of diabetes, hypertension, and obesity continue to strain health systems and budgets. This week brought a positive development on that front. Saudi Arabia's comprehensive policies to fight obesity and NCDs won a top UN award, more in wellness section, reflecting the country's multi-pronged approach from sugary drink taxes to public fitness programs. But other countries grappled with worsening NCD risk factors. For instance, Kuwait, which has one of the world's highest obesity rates, has been implementing new school canteen regulations to ensure healthier food for children, no more sugary drinks and junk food on campus. This week, Qatar did something similar on a different aspect. On October 2nd, Qatar's Ministry of Public Health intensified inspections of school canteens to enforce food safety and nutrition standards. With schools back in session, Qatar wants to prevent foodborne illness and promote healthy eating among students. These preventative steps target the roots of NCDs, poor diet in youth, and also guard against acute issues like food poisoning outbreaks. The economic freefall in Lebanon continued to manifest as a full-blown public health crisis. By this week, more than 3.7 million Lebanese, over half the population, are estimated to need humanitarian health assistance due to medication shortages and the collapse of health services. Essential medicines in Lebanon are either unavailable or exorbitantly expensive. Over 70% of the population has been pushed to rely on the Ministry of Health or charitable NGOs for care since they can no longer afford private healthcare. Out-of-pocket health spending in Lebanon has soared to 85% of total health spending, an unheard-of figure that means families are going without care. This week saw continued reports that patients are rationing medications or stopping treatment for chronic conditions like cancer and heart disease because pharmacies are empty. The situation is compounded by a massive healthcare brain drain. Approximately 3,000 doctors and 5,000 nurses have left Lebanon since 2019 in search of better opportunities abroad. This flight of skilled professionals has left some hospitals with skeleton crews. Entire departments, like intensive care or oncology units, have shut down in certain public hospitals due to lack of specialists. Earlier in the year, some Lebanese hospitals had to turn off generators for parts of the day due to fuel costs, causing life-threatening service interruptions. Although no dramatic new turn was reported during our specific week, the trajectory remains dire. Essentially, Lebanon's once-lauded healthcare system is imploding under economic pressure, and aid groups are now treating Lebanon akin to a humanitarian emergency zone. The WHO delivered shipments of medical supplies to Beirut recently, and NGOs like International Relief Teams are distributing donated medicines to clinics. But these are band-aids on a gaping wound. Health officials warn of potential outbreaks in Lebanon as well. Immunization rates have dropped and diseases like measles have resurged, nearly 20,000 cases of measles rubella by October 2024 in Lebanon. In sum, Lebanon's public health challenge is a sobering example of how an economic collapse can translate into morbidity and mortality on a large scale. Amid these crises, there were also proactive efforts to address public health threats. Jordan, relatively stable, took a novel approach to drug addiction recovery by integrating fitness and wellness into rehab programs, as we saw in August with the Amman Rehab Center gym opening. That program continued this week with reports of positive patient engagement in exercise classes as part of therapy, a small beacon of innovation in mental health and preventive care. In Sudan, outside our core region but impacting it, a cholera outbreak in 2024 had killed over 2,400 people across 17 states, aid agencies in early October 2025 were scrambling to prevent spread into refugee camps in Chad and Egypt, which would compound regional public health burdens. And globally, October 8 was World Sight Day, which Middle East countries used as a platform to promote eye health, Qatar's campaign described in Wellness section. These show that even as acute crises grab headlines, public health authorities are still trying to push forward on preventive measures and awareness for the long term. Overall, this week's public health developments paint a dual picture: acute crises in some parts of the region and persistent endemic challenges in others. Conflict zones like Gaza, Syria, and Yemen suffer a convergence of trauma injuries, infectious outbreaks, and systemic collapse that demands urgent humanitarian intervention. Middle-income countries like Lebanon and Iran show how economic and political breakdowns can yield health catastrophes reminiscent of wartime. At the same time, Gulf states and others are grappling with slower-burning epidemics of NCDs and lifestyle diseases, requiring sustained education and policy shifts, taxes on soda, better urban planning, etc. The common thread is that health gains can be fragile, decades of progress can be undone rapidly by war or economic shock. It reinforces calls by health experts for greater international support and regional solidarity. Indeed, the region's health leaders increasingly recognize that collective action is needed, whether it's negotiating ceasefires to protect hospitals, pooling resources for vaccination drives, as OIC is doing for polio and cholera, or sharing expertise to prop up failing systems, as Saudi is doing via telehealth with Syria. Without such measures, the Middle East risks a widening gap in health outcomes, where some countries surge ahead with world-class care while others struggle with 19th-century plagues. The events of this week underscore that health security is inseparable from peace and economic security. Protecting and rebuilding healthcare in the region's vulnerable spots is not just a moral imperative but also crucial to its stability and development. Next is the all-important evolving digital health innovation. Digital health innovation was a prominent theme in the Middle East this week, as countries continue to harness technology to transform healthcare delivery and collaboration. Oman took a notable step by hosting the Doha Forum for Health Digital Transformation in Salalah on September 26 to 27, just before our week, under the banner, Digitization of Health and Innovation, towards an outstanding, sustainable healthcare service. While the event itself was last week, its outcomes carried into this week's discourse. Omani officials showcased pilot projects using telemedicine to reach remote communities, efforts to create a unified electronic health record linking public and private providers, and exploratory uses of AI for predictive analytics in healthcare. The forum concluded with calls for greater public-private partnerships in digital health, acknowledging that a robust tech ecosystem, including startups, telecom operators, and global IT firms, is needed to implement e-health at scale. By early October, Oman's Ministry of Health was already acting on forum recommendations, announcing plans to roll out telehealth services to additional rural clinics and initiating an assessment of hospital IT systems to identify integration gaps. Oman's push reflects a broader regional realization that digital tools can greatly enhance access and efficiency in healthcare, especially for countries with dispersed populations or limited specialist availability. A groundbreaking example of digital health diplomacy emerged between Saudi Arabia and Syria. On September 21, late the previous week, Saudi Arabia launched a digital health link between its Sayha virtual hospital and the Syrian Ministry of Health, and the effects of this were felt in our week as the program got underway. This initiative, cemented by and now signed by Saudi Health Minister Dr. Fahad Al-Jalajel and Syrian Health Minister Dr. Musab Al-Ali, establishes direct connectivity between the Saudi virtual hospital platform and Syrian hospitals. In practice, it allows Syrian doctors and patients to remotely access Saudi medical expertise and consultations in real time. For example, a complex case in Damascus can now be reviewed via telemedicine by a specialist team in Riyadh, who can guide Syrian clinicians on diagnosis and treatment options. The link provides round-the-clock access to over 150 Saudi subspecialists across fields like radiology, cardiology, and critical care, effectively bringing tertiary care to Syria virtually. Saudi officials noted this will improve response times for critical cases in Syria and help establish a more robust health system there, as part of the kingdom's support for Syria's post-conflict recovery. This is a remarkable use of digital health as a form of soft power and humanitarian assistance. By leveraging its advanced telehealth infrastructure, Sayha Virtual Hospital connects over 200 hospitals within Saudi. Saudi Arabia is able to extend services beyond its borders without a physical footprint. It solidifies Saudi's position as a premier regional center for virtual medicine and digital transformation, an explicitly stated goal of the program. For Syria, still rebuilding and with large parts of the country lacking specialists, this link is a lifeline that can elevate care quality immediately. It's also symbolic. The renewal of Saudi-Syrian cooperation, after years of estrangement, is being driven in part by digital health, suggesting that healthcare can be a bridge for diplomacy. Saudi Arabia also demonstrated digital health prowess on other fronts. The UN award it won, mentioned earlier, specifically lauded the kingdom's use of the Sehati mobile app to engage the public in wellness. This app, initially launched during COVID-19 for vaccine appointments, has evolved into a one-stop digital gateway for Saudis to access services, booking doctor visits, getting lab results, managing prescriptions, and even signing up for things like blood donation drives. The fact that WHO highlighted Sehati indicates it's considered a best practice in how a government can integrate digital tools into public health initiatives. Additionally, Saudi Arabia's Sayha Virtual Hospital, SVH, itself achieved a Guinness World Record this year for being the largest telemedicine center globally, connecting over 130 hospitals and enabling thousands of virtual consultations. This week, Saudi media touted SVH's expanding services, now including specialized tumor board reviews and stroke management consults, and emphasized how it eliminates geographical limitations by bringing top specialists to any hospital in the kingdom virtually. During Health Minister Al-Jalajal's travels in late September to New Zealand and Australia, Saudi Arabia shared these digital mental health and virtual care models as exportable ideas. The minister's discussions abroad about integrating Saudi telemedicine with foreign systems show that digital health has become a tool of international collaboration and prestige for the kingdom. The United Arab Emirates continued to augment its smart healthcare infrastructure. The UAE has been working on two key nationwide systems, Riyadh, unified electronic medical record across the country, and Malafi, the Abu Dhabi Health Information Exchange. By late August, Riyadh had onboarded many private clinics, moving closer to a truly unified patient record that any provider can access with consent. Similarly, Malafi achieved near-total participation by Abu Dhabi hospitals, meaning a doctor anywhere in the Emirate can instantly pull a patient's history from any facility. These digital foundations paid dividends during COVID-19 and continue to do so, enabling e-prescriptions, automated public health reporting, and AI-driven analytics for decision-making. This week, Dubai Health Authority officials hinted that the forthcoming Future of Health Summit, early next week, would include announcements about AI guidelines, as noted, and possibly an expansion of the Doctor for Every Citizen telehealth program. Meanwhile, Qatar expanded digital services in primary care. On October 2, it opened a new urgent care clinic at Al-Wajba Health Center with fully integrated digital triage and appointment systems to streamline patient flow. The system allows patients to walk into any of 13 urgent care centers regardless of which center they are registered at, thanks to a centralized digital platform coordinating records and visits. Qatar's Primary Health Care Corporation also noted rising uptake of its recently launched Naarcam app, previously referred to as Labay, for scheduling appointments and teleconsults. By late September, thousands had used it for services like medication refills and virtual follow-ups. This indicates that the public is increasingly comfortable with app-based healthcare management, a trend mirrored in other Gulf states. On a regional level, digital health was highlighted as crucial for public health surveillance and emergency response. The WHO's Eastern Mediterranean office held a simulation in Cairo, as mentioned, on coordinating migrant health, which concluded on August 25 with a recommendation for standardized digital platforms for cross-border disease surveillance. With multiple Middle Eastern countries facing large movements of people, refugees, pilgrims, labor migrants, having real-time data sharing, e.g., a cholera case in one country instantly flagged in a neighbor's system, could be life-saving. Finally, we have population health management. Population health management, the concerted effort to improve health outcomes for entire communities or demographic groups, was a key focus in the Middle East this week. Countries launched initiatives targeting specific populations, students, refugees, women, etc., and leveraged data to better plan services that reach beyond individual clinical care. One major theme was the health of students and youth, given the new academic year underway. In the United Arab Emirates, Emirates Health Services, EHS, announced it had fully implemented its preparations for the 2025 to 2026 school year to ensure a safe and healthy environment for students. This included deploying qualified doctors and nurses to all 333 public school clinics nationwide and stocking them with essential medicines and supplies. EHS also distributed a back-to-school guide for parents and students with practical health tips covering nutrition, sleep, hygiene, and managing common illnesses. Crucially, the UAE expanded its student health screening program, adding new age-appropriate screenings for vision, hearing, and early signs of chronic conditions, beyond the usual immunizations. Last school year, over 95,000 students received routine vaccinations through school clinics under the National Immunization Program. Building on that, authorities plan more awareness campaigns in schools about vaccinations, healthy eating, and hygiene to boost overall child wellness. The UAE emphasized parental engagement as well, urging families to ensure kids get enough sleep and healthy meals, recognizing that home environment is a big part of population health for children. The comprehensive nature of the UAE school health strategy exemplifies population health management. By proactively keeping its youth healthy now, the nation aims to reduce disease burden in the future. If students have vision issues corrected early or learn lifelong healthy habits, there will be fewer advanced problems later on. In Iraq, a noteworthy effort targeting youth was wrapping up. The country concluded data collection for a national school-based student health survey, Global School Health Survey, that had launched earlier in the year. Throughout our week, teams were finishing surveys in schools across provinces. This survey covers behavioral health risks among adolescents, things like dietary habits, physical activity, tobacco, drug use, and mental health indicators. Once analyzed, the results will guide Iraq's interventions for youth health in coming years. Even though the survey began in March, the sustained commitment to see it through despite Iraq's security and political distractions is commendable. It shows a drive for data-driven health planning. Population health management relies on such data, knowing, for instance, what percentage of 15-year-olds smoke or how many get regular exercise is critical to designing the right programs, be it anti-smoking campaigns or sports facilities. The survey also likely includes mental health and violence exposure questions, which can inform policies on school counseling or anti-bullying measures. This is Iraq's first comprehensive youth health survey in over a decade, so it's a major step in rebuilding its public health intelligence. Managing migrant and refugee health emerged as another priority, intersecting with population health management. As mentioned earlier, a WHO-led simulation in Cairo, August 18 to 20, with Egypt, Libya, Sudan, and Tunisia addressed health coordination for migrants. By the exercise's conclusion, reported on August 25, these governments called for standardized health procedures at borders and agreements between neighbors to ensure migrants receive basic healthcare and to contain disease spread. They recognized that displaced populations often live in overcrowded, unsanitary conditions, heightening risks of outbreaks that can affect host communities too. Recommendations included joint surveillance for outbreaks among mobile populations and making sure refugees can access vaccinations and care without fear. In practical terms, this means if a child refugee crosses from Sudan to Egypt, there should be protocols so that child gets the same immunizations in either country's camp, and if a cholera case pops up near the Libya-Tunisia border, both sides are alerted instantly. These are essentially population health measures that go beyond one nation, treating the region or migration corridor as the population unit. During our week, Egypt's Ministry of Health was reportedly drafting an agreement with Sudan on mutual recognition of vaccination records for people crossing the border, as an immediate follow-up to the simulation. Also, Jordan, though not in that simulation, has been doing something similar by integrating Syrian refugees into its national health programs where possible. Yemen, home to one of the world's largest humanitarian crises, saw a small but positive step in population health through cooperation with Jordan and aid agencies. Aside from the high-level plan for treating Yemeni patients in Jordan, mentioned in policy, on the ground in Yemen this week the government coordinated with WHO and NGOs to distribute nutritional supplements and hygiene kits in camps for internally displaced persons, IDPs. Tens of thousands of at-risk children and pregnant women in those camps received vitamin A drops to boost child immunity, oral cholera vaccines, and water purification tablets. While such efforts were overshadowed by other news, they directly address population-level vulnerabilities by aiming to prevent malnutrition and disease among those specific groups, children under 5 and expectant mothers, who are most vulnerable. Additionally, as mentioned earlier, Yemen recorded over 100,000 suspected cholera cases in 2025 by end of August. Health partners intensified hotspot mapping and targeted sanitation drives and mobile clinics to the worst affected communities. This is classic population health management, identifying high-risk locales, e.g., neighborhoods with contaminated water, and concentrating interventions there to quell spread. It's not about treating one person at a time, but rather using data to deploy measures that protect the entire community. Wealthier Gulf states also implemented preventive measures for specific population segments. Kuwait's Ministry of Health kicked off a national health survey on August 27, as noted, and during our week they ran an awareness campaign urging households to participate. The survey statistically samples households across Kuwait to assess prevalence of risk factors like smoking, diet, and chronic disease in the population. The MO's messaging emphasized that by contributing confidential health data, residents help shape future health services and policies. Essentially, Kuwait is gathering the population health data needed to inform resource allocation. For instance, if the survey finds a high rate of hypertension in certain areas, more clinics or awareness programs can be directed there. Simultaneously, Kuwait this week reinforced its school health policies, as discussed, implementing healthier canteen menus to improve student nutrition, a move directly targeting the youth population's diet quality. And in Iran, despite systemic woes, some provinces took community-level initiatives. For example, in Mashhad, Iran's second-largest city, health workers in late August launched a door-to-door campaign to educate families on preventing household spread of COVID-19 and influenza ahead of the fall season. Across these activities, the region is showing a critical shift toward proactive population health management. There's a growing emphasis on collecting and using health data, through surveys, electronic dashboards, etc., to guide interventions. Countries are segmenting their populations, students, migrants, mothers, etc., to tailor health programs to each group's needs. And there's a focus on preventive care at the community level, intervening early via school health, immunization drives, nutritional support, and risk factor reduction, rather than waiting for people to fall ill. This shift is partly driven by necessity. The challenges are too great to handle purely with hospital-centric, curative approaches. Large youth populations, migratory fluxes, and NCD epidemics require managing health upstream. The week's developments, from the UAE school clinics to Yemen's aid distributions, illustrate that mindset in action. However, the challenges remain significant. In countries with instability or extreme poverty, even the best population health plans struggle. For instance, reaching every child in Syria or Yemen for vaccines can literally require ceasefires or negotiated access each time. And as Lebanon's crisis shows, without system-wide stability, population health gains, like high vaccination coverage in the 1990s, can erode. Yet, the strategies being deployed demonstrate a recognition that the health of a population is only as strong as its most vulnerable groups. That's why special attention is on those vulnerable: children, migrants, the displaced, the rural poor, students, and the elderly. By focusing on these groups, countries aim to raise the baseline of health and reduce inequalities. Managing health at scale, be it a school district, refugee camp, or a whole nation, is moving to the forefront of the regional health agenda. One interesting note: population health management is also coming into play for emergency preparedness. Saudi Arabia's large-scale blood donation drive, wellness-oriented but also building stock for emergencies, and the digital disease surveillance proposals are about protecting populations from shocks. The region's experience with COVID-19 also accelerated interest in population-level tools like contact tracing apps and mass texting for health advice, which are now morphing into general population health tools, e.g., apps that remind people of vaccine appointments or check in on chronic disease patients periodically. In conclusion, this week's population health initiatives underscore a hopeful trend. Middle Eastern health authorities are increasingly looking beyond individual patient care to the bigger picture of community well-being. Let's summarize this week's review. This week's Middle East health and wellness developments paint a picture of dynamic progress tempered by daunting challenges. On one hand, many countries forged ahead with ambitious reforms, innovations, and collaborative ventures to strengthen their health systems. Health authorities prioritized policy measures to enhance access and affordability, exemplified by Kuwait and Bahrain's new partnership to upgrade hospitals and workforce training, Qatar's sweeping pharmaceutical price cuts, earlier and current school health initiatives, and Oman's revamp of its NCD prevention policy. These initiatives reflect a shared regional commitment to bolstering healthcare infrastructure and aligning with broader national visions, such as Saudi's Vision 2030 and UAE's national agenda. Equally, the region demonstrated a rising profile in research, biotech, and digital health. Iranian scientists broke new ground with an AI-driven cancer vaccine. Saudi Arabia prepared major biotech investment deals and shared its telehealth expertise with Syria, and multiple countries expanded e-health platforms for more integrated care, like UAE's unified records and Qatar's patient apps. Such moves indicate that the Middle East is not just consuming medical advances but increasingly contributing to them, positioning itself as an emerging global player in health innovation. Public health and wellness promotion efforts added to this narrative of progress. From Jordan's inventive approach to addiction recovery through fitness programs, to Saudi Arabia's mass blood donation drive via a mobile app, to the UAE's multifaceted campaigns on breast cancer awareness, heat safety, and tobacco control, there is clear momentum toward preventive care and healthy living. Communities are being actively engaged. We saw school-based health screenings in the UAE, the Pink Caravan bringing free cancer checks to the public in Sharjah, and grassroots health volunteers in Iran and Syria educating households. These efforts are vital to combat the region's high burdens of non-communicable diseases and to cultivate a culture of wellness that complements clinical services. Population health management initiatives such as Kuwait's National Health Survey and Yemen's targeted aid in cholera-hit communities underscore an understanding that long-term health outcomes improve when entire populations are systematically protected and served. Notably, regional cooperation emerged as a key theme. Countries are increasingly working together on issues like migrant health, through unified surveillance, medical training exchanges, and knowledge sharing in pandemic preparedness, recognizing that health challenges often transcend borders and are best tackled collectively. Technology and innovation will continue to be game changers. Nations that harness digital health effectively are already seeing dividends in efficiency and reach, e.g., telemedicine linking specialists to remote areas, apps connecting patients to preventive services, and those lagging will need support to catch up. The collaborative spirit shown in joint exercises and bilateral agreements should be nurtured into more robust regional health networks, perhaps under bodies like the Gulf Health Council or WHO's Eastern Mediterranean Regional Office, to share resources and respond collectively to threats like epidemics or climate-related health crises. Indeed, climate and environmental health is another emerging challenge, extreme heat, water scarcity, that the region must confront with the same vigor it is beginning to address NCDs and infectious diseases. In sum, the Middle East is at a crossroads where tremendous opportunities for health advancement exist alongside ongoing vulnerabilities. The trajectory glimpsed this week, one of energetic reforms, innovation, and regional cooperation, offers hope that the region can navigate its challenges and continue improving health and wellness for its people. As always, sustaining momentum will require political will, adequate funding, and peace. But the vision of a healthier Middle East, one where all populations have access to quality care and the chance to lead healthy lives, feels closer than ever, provided the lessons of this week spur continued action. In summary, the week of September 25 to October 2, 2025 underscored both progress and ongoing. For more information about any of the topics discussed here, or if you would like to learn more about Al-Ghaf Dynamics and our extensive range of services and solutions in healthcare, life sciences, and wellness for the Middle East, please don't hesitate to contact us. Visit us at our website or email us directly. Additionally, scan our QR code for all our links. Thank you for listening and see you next week.